Hello, I'm Dr. Rishi Desai. I'm the Chief Medical Officer at Osmosis, and I apologize for the technical disruption there. We lost 15 minutes, but I can go on for about 15 minutes more to help balance things out. Apologies for that. Let me just jump right into the questions. So, a couple of little things I wanted to mention. We're stressing each week some key points in terms of things that you can do to help with COVID-19. First message, stay home. Second message, do your part to help flatten the curve and raise the line. What that means is make sure that you're not going out and infecting others. Maybe you're not symptomatic, but you may not know that. So any interaction you can kind of minimize, that would be ideal. If you are symptomatic, stay home, take care of yourself at home if you can, if you have mild symptoms, and only go in if you have severe symptoms. In terms of raising the line, that means making sure that we have good protection for our healthcare workers with PPE and 95 masks. Make sure we get more frontline healthcare workers, meaning get new people trained up quickly, get retirees, get med students, nursing students that are about to graduate. Let's get them out there. And let's make sure that we have enough equipment, ventilators, beds themselves, ECMO units, and all the other kind of medications that people need. Let's get those things out there and make that front and foremost for our hospitals to prioritize. So those are the kind of messages we want to try to promote. If you go and take the pledge on Osmosis right now, you get 3 free weeks of Osmosis Prime. And if you want to stay up to date with all the stuff related to COVID-19, obviously you can join the Ask Me Anythings, and we welcome that. But I want you to also go to osmosis.org/COVID-19. We've got tons of awesome infographics and videos that are updated constantly. We're putting new information out there, also dropping more YouTube videos as well, doing a daily drop on that as well. So anyway, that's all to say. Thanks for coming. Let me just dive in right into the questions. Question is, can we truly contain the virus? This is kind of more existential question. I would say, again, making sure that we watch how we're spreading the disease is the first part. And then now the battle lines are really moving to the hospital setting. So everything we can do to get PPE for healthcare providers, that is the next big thing we need to focus on, is healthcare providers and what we can do for those folks to keep them safe. Next question. I have lupus. I've been on Plaquenil for years. Am I protected from COVID? There is data on hydroxychloroquine and azithromycin used in combination. There's also data on hydroxychloroquine and chloroquine, ritonavir, remdesivir. There's a number of medications out there. There is no confirmed data on prophylaxis. There's no confirmed data on treatment. All those studies were done in small sets, and they were interesting studies, but they weren't randomized controlled trials, and there are toxicities to those medications to keep in mind as well. So certainly no evidence that you are going to be immune from getting COVID-19 based on the data. Next question. Have you, please talk about long-term immunity of coronavirus. So there are some studies out there that are looking at this. They've actually taken a cohort of individuals in Germany and checked their antibody levels, checked a month later, and antibody levels were still quite high. So the number of antibody molecules or protein that you have in your blood, that titer was still quite good. So that means that the immunity at least lasts for, let's say, a month or so. The other piece of it is how functional is that immunity? And one interesting study was they literally took macaque monkeys, infected them with COVID-19, got them the disease, and then actually re-exposed those monkeys after they'd recovered to see if they would get the disease again. And it turned out the macaque monkeys did not get the disease again. So actually that was really interesting data in a monkey model to show that actually reinfection with COVID does not seem to happen, at least short term. So we believe that based on this kind of data, you do get good sustained immunity. The question is, how sustained is it? And at the moment, I would say most research around coronavirus immunity seems to indicate that it's months to years. So really having an immune status is a good sign that you may be actually able to go back onto society with a positive titer. In fact, an idea we dropped on YouTube yesterday was this idea of an immune certificate that you might even imagine people get to say that they're willing and able to go back onto the community. Next question. Besides staying home and using hand sanitizers, what is the best way to prevent from getting it? You know, the first part of that is the most important part, staying home. So as long as you stay home, you're not really exposed to anybody outside. You're not going to get exposed. So that's the key. As much as you can, stay isolated. If you have to go to the grocery store, make it a once-a-week trip, or ideally once every 2-week trip. You go there, you wear a mask on your way there. You make sure you don't touch your face, you don't touch your mask, you don't kind of fiddle with your mask. You touch whatever you need to, come home, wash your groceries, wash your hands thoroughly because you've been outside, and then you take the mask off. So that's what I'd recommend for anyone that's going to be trying to figure out ways to minimize their chance of getting COVID-19. That is doubly important for people at risk. So people that are older, immunocompromised, and people that might be at risk where we're not quite sure. So folks like pregnant women, those are precautions they should be taking. Why do doctors and nurses get infected even though they use masks, gloves, and in some cases helmets covering their entire face? How do they get infected? So keep in mind, when doctors and nurses eat food, clearly the mask is off. So they're being exposed to each other. That's the first thing. There's also this idea that that if you wear a mask and gloves and goggles, you're totally immune. It's all about doses. So for example, if you wiggle a little bit, or if you have a break in your seal, which can happen based on the way your face is moving, if you break that seal even a little bit, you're letting passage of air. And when I say doses, the people that are working in the healthcare community or the healthcare setting, they're exposed to large inoculums of virus, right? Because people are very sick. So they're getting large inoculums of virus, large amounts of virus, and they're getting repeated doses because they're seeing maybe 3, 4, 5, 6 cases of COVID-19, maybe in as short as time span as an hour. So when you're getting repeated doses and big doses, you're much more likely to get sick, even if you're young and healthy. And in fact, that's one of the risks of healthcare workers not having good protection, is that they need the best protection to prevent themselves in that environment. Next question. How about the use of convalescent serum in patients? Great question. Convalescent serum, again, is antibodies from people that have already recovered. This is being looked at seriously. The CDC is doing a study on this themselves. And what that means is you take antibodies from people that have recovered and give those antibodies, those protein molecules, to people that are sick. And by doing that, you're giving them what's called passive immunity. And that passive immunity doesn't last forever, but it can tide someone over until they can kind of recover by themselves. So that's the same sort of passive immunity that a mother gives to a baby as they're delivered. It's literally just giving the antibody itself. And that's something that's being, again, studied very closely. Next question. How many days does it take before showing symptoms of COVID-19? So the median incubation time, that number of days is called incubation time. So let's say I was just exposed to someone right now. I just, maybe I touched something that they had just sneezed on, or I was in their face and they coughed on me. And if I was vulnerable, meaning I'd never seen COVID-19 before, I'm vulnerable, then that virus can get into my body. And typically it takes a median of 5 days to get symptoms. And maybe on the 5th day, I would begin to feel a sore throat. I'd begin to have a runny nose, maybe some congestion, maybe even a cough, fever, and shortness of breath. So those symptoms typically start 5 days or more. The incubation can be much longer. And in fact, that period can be up to 14 days or even as long as 24 days. So there are some cases where it's been longer than that. So just keep in mind that it can be longer, and that's something that you have to be really thoughtful about, because what's happening right now is that a lot of people that think they're fine are actually in that 5-day window or 14-day window, depending on who the person is. And they go around, they're interacting with other people. They don't know that they have the virus. They're touching their face, they're touching objects, and they're literally spreading the disease much quicker than if they had just stayed home. Next question. Speak about your health for a few seconds. As you can see, I'm coughing, and so I do have symptoms that are classic. So cough, I've had some fevers, I've had some shortness of breath. These are symptoms that for me are mild. So I've had these symptoms many times in my life, right? I've had the flu, I've had colds. So I've had these symptoms before. In this particular context, am I worried about COVID-19? You bet I'm worried. Of course, I think I might have COVID-19. And so I'm monitoring. I'm at home. I'm monitoring myself. I'm drinking a lot of fluids. I can prove it. I've got water right here. And I'm making sure that I'm doing all the right things to get better. And if I don't see that getting better, and mind you, I am actually getting better. The fevers have gone away. Some of that shortness of breath has gone away. So I have this lingering cough, which sounds worse than it is, but that's what you should be doing too if you have symptoms. It's just kind of monitoring closely, making sure that you're getting better. And when available, getting tested. At the moment, testing has been hard to come by, and so a lot of doctors are saying, don't get tested at the moment. But as testing becomes more available, that will be something people can start doing. And certainly home testing will become available too. So that's something to keep in mind. If you're not infected, do you need a mask? If so, what's the purpose of the mask for someone who's not infected? This is a very, very hot topic right now. Do people that do not have symptoms need a mask? And what I'll say is the following. The guidance that we've gotten from the CDC, the rules that they've laid out, are changing based on supplies. And initially, the thought was, hey, you know what? We have a shortage of masks, especially N95 masks. Those should not be used by the general public. Those should be used by health professionals. How do I feel about that? Totally agreed. 100% that's the right thing to do because our health professionals do not have enough N95s and they desperately need them. So if you have one, if you can spare it, drop it off, donate it because a health professional will get it and will be so happy to have it. And that might save that person from getting the disease themselves. Having said that, let's say you have other masks, like a surgical mask, or you make a mask at home. Is it a good idea to wear? What I'll say is yes, if, and this is the caveat, if it means that you'll touch your face less. Because we know that asymptomatic people are spreading it, or pre-symptomatic people are spreading it. And the way they're spreading it is they're touching their face and they're touching objects. So if you can go to the grocery store and you wear a mask, and let's say you have no symptoms, but you wear a mask, and that means that you're not touching your face, you're not touching your face and then touching objects. That means that if you were pre-symptomatic or asymptomatic, which maybe you are, then you're less inclined to be spreading it. Now, again, if you are having symptoms like I'm having, you should definitely be wearing a mask in situations where you're not speaking to a YouTube audience or you're not eating food or something along those lines. So that's the catch, is that you have to make sure that if you are doing those things, you wear a mask. And when wearing a mask, the main reason for it is to prevent touching your face and spreading it with your hands. Next question. Do you, doctor, you look happy. Is there a reason why you are? Talk about the importance of mental health. So I appreciate that. I am a happy person in general. I have, many reasons to be happy. I will say that the hardest thing for me personally right now is the lack of good structure to my day. So normally I have a certain cadence and rhythm to my day. I get used to that rhythm. And right now that's completely disrupted. And so what I would suggest is if you're looking for ways to improve your mental health and your feelings of depression or anxiety specifically about COVID-19 and maybe about your job and about other things that you may be thinking about, the number one thing you can do is create a sense of rhythm to your day and structure. For myself, that means spending time with my son. That means spending a definite 30 minutes in the afternoon, every afternoon with him, and just playing a game. He's 3 years old, he's lovely, and spending time with him for me is a wonderful way to take a break. So I would recommend the same thing for you, is to find some way to do that. Question. There are 8 strains of coronavirus. How do we know which one is deadly? So there's a great website called Next Strain. You can check it out. They actually map out the mutations that they're seeing in real time as we capture the coronavirus. We're basically sequencing the RNA of that virus and saying, how does the RNA change over time? Is this strain that's in Atlanta, Georgia, the same one that's in Seattle, Washington? What about the one in Ontario versus the one in, let's say, Dhaka? So understanding how the strain is changing over time helps us understand how we respond to it. Going back to that immunity question, what I'll say is that these strains, the question said 8 strains. In reality, you could probably make the argument that it's many more than 8, right? Because there's so many little mutations that are occurring, and there will continue to occur because viruses mutate, and that's normal. What we need to care about is how is our immune response going to work against something that is mutated? So the good news is that our immune response, our antibodies, are mainly targeting one protein, which is called spike, and spike protein is on the outside of the virus. And that protein doesn't seem to be mutating a whole heck of a lot. So it's pretty steady. And so that's good because that means that if you've essentially mounted a good immune response to this spike protein, when it changes and mutates, which this protein probably won't mutate much because that's what we've noticed, that your immune response is still going to be pretty robust, even though the rest of the virus might be a little bit different. So that's a really good sign, and means that as people recover, we're going to get a wave of people that are basically resistant to getting the virus again in the weeks and months to come. Less common symptoms. So the main symptoms we talked about are fever, cough, shortness of breath. Another very common one is fatigue. Less common symptoms are the symptoms that you might get with any sort of viral illness, and a big category is GI symptoms. So having gastrointestinal discomfort or pain is associated with COVID-19, and so you could get, cramping, you could get diarrhea, constipation. These sorts of symptoms have been reported with COVID-19. In kids specifically, they seem to notice that you do get kind of milder symptoms. So you could have kids that get just kind of a runny nose or maybe a sore throat and maybe none of the other symptoms. So there are some less common symptoms. How do you play with your son while you have symptoms? So I will say that in a small household where it's not possible to cordon off, typically everyone gets the same symptoms. So all of us are sort of dealing with these symptoms, and in short, therefore, we're all kind of getting better together. I work in healthcare and COVID-19 with COVID-19 patients. Should I quarantine myself or my family completely after I come back home from work? Great question. I think quarantining from your family after you've been exposed to folks in the hospital is a very, very important thing to do, especially if people in your family might be at high risk. So for example, let's say your partner has diabetes or your mother-in-law lives with you and is over the age of 60. In those situations, it's very important. In any other situation, it's still very important. So some of this has to do with your logistics. Maybe you have a house which has multiple bathrooms, multiple rooms. Cordoning yourself off to one room, one bathroom that others don't use is a good idea. Changing your clothes when you come home and washing up immediately and thoroughly is a good idea. Clipping your nails, not having objects on you where there are places that the virus can essentially linger is a good idea. So those are all important things to do to make sure that you're essentially keeping your home as clean as possible when you get back into it. What do I think about the mask for all movement and aerosol transmission of the virus by asymptomatic patients? There is no doubt anymore that asymptomatic and pre-symptomatic patients are spreading the disease. There is still a question of how much they're spreading it, and I think increasingly the consensus seems to be a lot. And so if we think that asymptomatic and pre-symptomatic people are spreading it a lot, that means that we need to be very, very serious about getting more and more people masked up, as I spoke about earlier. So what that means is when you leave the house and you're going to other areas, it's very important to keep a mask on to prevent sort of large particulate matter from getting out there. When people have a mask on, it prevents large balls of spit basically from getting out. It also prevents your face from getting hit by other people that may be coughing as well. Even more important than that is it prevents you touching your face. So if I can prevent myself touching my face and then touching objects, then that mask has done its job. Where it could backfire, and there's criticism around this, is what if I'm now fiddling with my mask, touching my mask, and kind of moving and manipulating my mask? Now I'm actually touching my face a lot. And so that's the key thing you have to be very vigilant about, is that in wearing a mask, are you now touching your face more? In which case you've really defeated the whole purpose of wearing one. For states and jurisdictions that are slow, reluctant to institute strict quarantine, what can we expect in terms of a peak? Great question. So the idea of a strict quarantine and isolation is to really force people to minimize all non-essential movement. So essential movement would be like getting groceries, getting your medications from the pharmacy, the police department, fire department. Certain things have to stay open, but other things don't need to. And the more we can drive towards it, I don't want it to be necessarily an on or off switch. I want you to think of it as a dimmer switch, where if we can slide towards this idea of kind of allowing people to do less and less of the non-essential stuff, then we're going to see a slowdown. The virus ultimately has to go from one person to another person. Anything you can do to minimize the number of times human beings in a community interact with each other, almost like imagine little balls bumping into each other. The less they're bumping into each other, the less the virus is going to be on this exponential growth. And so it really will matter in terms of not whether people are just isolating or not isolating, but to what degree are they isolating, as to what that curve is ultimately going to look like. All right, let's see. Say the lockdown ends in a couple of months and people start traveling. Will there be another pandemic? Talk about the lockdown. Is this good? Should we do it? It's a great question. One thing that will happen is the moment that we start seeing the number of cases start to come down, there will be questions about, hey, can we relax the restrictions, right? That's an immediate question. At that point, instead of immediately relaxing the restrictions, I think the better strategy would be to do blanket immunity testing. test people to see who has evidence that their immune system has recovered and is now resistant to the virus. And if you could do that, you might even issue, and this is an idea that was actually talked about in Germany already, immune certificates. You could say, hey, these are the people that can kind of go out and restart their business, and other people need to kind of wait it out until the cases really drop off. Once that starts happening, you start to kind of revitalize the economy and normalize how things go. And I think, again, with things like continuing to have people wear masks, assuming that the supplies of general masks, not N95s, but general masks are solid, then I think that we're in a good position at that point, once the cases are much lower, to start easing restrictions. We have now gone through this experience of COVID-19, and the world is going through it. I think they'll take COVID-19 much more seriously if there's a resurgence of cases, meaning blanket testing, aggressive isolation of people that have it, so that we don't see it kind of surge up again to this extent. Hopefully, we will have learned our lesson by that point. What are the chances that it will become seasonal and so hard to get rid of, like influenza? That is an excellent question, and there is no solid information we have on COVID-19. It's only been around for a handful of months, right? So we don't really know whether it's going to become seasonal or not. What we do know is that lots of people have it, and generally when lots of people have it, it has a way of circulating for a long time. Now, it could become seasonal. That would expect that there would be enough shifting in the virus and that immunity would wane to cause it to resurge. And so we'll have to wait and see if that ends up being the case. I think that there was a lot of hope that this would kind of go away in the summer months. I think clearly by the number of cases, the fact is that we're rising in cases, not falling. And so we'll have to see how this year plays out as to whether this becomes a cyclic thing. I will point out that coronaviruses normally make up about a quarter of all URI symptoms. So a quarter of all of our kind of cough and cold symptoms are related to the coronavirus. Other coronaviruses, not COVID-19. So this is part of our normal battle with coronavirus. This one just happens to be a new one, but there are a family of coronaviruses that we struggle with as a human species all the time. Do you think it's safe for medical students to return to clinical rotations? If not, and the move is towards virtual learning, what is the solution to losing out on valuable clinical experience? Great question. There are many things that students can do today to stay on top of their education and get good clinical experience. So one thing, I'll make a plug for the fact that Osmosis is an education platform. We have set up stuff for COVID-19. If you just go to osmosis.org/COVID-19, you'll see all of our videos. It's all free. But on top of that, we've offered the entire platform of medical education for free. So as a starting point, I would just start going using those resources and staying up to date with all the diseases that you would encounter as a medical student. Now, you asked about clinical experience, which is a little different. And there, what I'll say is that in general, right now, there are lots and lots of groups trying to figure out how to make better clinical experiences for third and fourth year medical students, and while also keeping them safe. Some fourth year med students are hitting the front lines. You may have seen that with NYU famously. They're allowing the doctors to graduate early so they can get out there quicker. Some students are doing virtual rotations. So there are lots of interesting solutions, and you can plug into your med school and reach out to us if you have ideas on how we can get you the education you need. Okay, so that's the end. I'm going to pause it given that it's 3:40 my time Pacific here. A few things I do want to say. We're doing a daily report on COVID-19 now. I'm dropping videos every single day on a different aspect of COVID-19. So check out our YouTube channel and watch those videos. Some of what I talked about today was actually in the video from yesterday. We also put together a course for COVID-19. It's on Coursera. It's got more content. You can actually earn 2 CME credits for it. So check that out. We want you to make sure you do the pledge. You get 3 free weeks of Osmosis, especially that last question about how to stay up to date. Go and do the pledge. You get 3 weeks of our platform. And essentially what you're signing to is that you're going to help out with raising the line and flattening the curve. Essentially, don't forget about the other question about mental health and physical health. It's really good to get a rhythm going to clear your mind so you're not feeling like you're living and breathing COVID-19 constantly. A big part of that is also physical exercise. We didn't talk about that today, but I want you to keep that in mind. That's a key part of that, as well as your mental health as well. On Saturday, we're doing a live yoga session to inspire you to join us to do something physical that will hopefully get our heart beating and feeling good. Also, We'll be doing this again next week, so please enter your question. I'll be here to answer those questions, same time and place, and it's going to be all about COVID-19. And then I've mentioned it a few times, but osmosis.org/COVID-19, go there to watch our videos on it. We're dropping new videos constantly and infographics to keep you up to date and fixing anything that may be new or changed from previous knowledge as well. Ultimately, we have your back, and so I want you to be well. Take care.